Doctor, it is obvious that COVID would have had an impact on sexual wellness, sexual intimacy, and relationships.
Yeah, you're right, because this pandemic is something that we did not expect. It came and hit us suddenly, and it put a lot of people's lives in jeopardy. So it started changing the way we look at things, it started changing the way we interact with each other. So obviously the norms that we are usually following right now is social distancing. So it has a lot to do with relationships, friendships, intimacy, and obviously sexual wellness. So the way COVID is affecting us is because of the way it can spread. So it has affected relationships in a lot of couples that I've been seeing. So one is the way we are going to work. What we were doing earlier has changed. So we're not going to work anymore. We're at homes all the time, and our schedules have changed. The way we are looking at this entire scenario, the COVID itself, is with a lot of sense of insecurity and fear too. So there is a multiple dimensions to these aspects that we need to understand today. Because only when we understand the multiple dimensions, then we'll be able to figure out what is that exactly it means to us. When we understand what this means to us, then we're in a better position to sort of see how we can identify if at all there's a problem, and see how we can improvise the relationships, etc. So if you ask me, especially with respect to the couples, so it can be two ways. In some of the couples that I've been seeing, and generally also what I hear from my own patients and clients, and also what I understand from the general public, is that it has improved a lot of relationships. It is interesting to understand why, because the kind of lives that we were leading earlier was a robotic life, monotonous life. We were all programmed to wake up at 6, catch the metro or the train or travel to work, which could take up to 2 hours for some people, long distance of commute, and couples working in different shifts. So we're all running the rat race. So obviously we have to keep up with the work and the timings, etc. So this was causing a lot of problems in couples, though they want to spend time together. Because of their duties and responsibilities and career, they weren't able to spend time. So for those kind of couples, this is a boon. Because now they have a lot of time, so they get to be intimate with each other. So they have a lot of time, which is because they don't have to travel to work. They don't have to do a lot of things otherwise. So they need to go out, get the grocery, shopping, and they're sorted for about a week. So they are the couples who are able to use this time efficiently to sort of improvise their relationship.
So you mean to say they can focus a lot more on
Yes, they can focus a lot more on that. They're using their times, they're using their intimacy to a greater need, because the only problem was the lack of time. But I've also seen another set of couples where familiarity breeds contempt is true for them. Because earlier they were able to sort of keep that excitement going because they needed their own space. So they would go about, do their work, they would just come back, get 3-4 hours of time. So that is how much they probably could tolerate. And I'm not saying there's nothing wrong with it, because all of us are different, to each his own. So some couples work on this principle where they need their own space, and when they come back together as a family unit, they're still able to enjoy that things in the brief period of time. So once they start having too much of time, they start invading into each other's space. So it could automatically result in a lot of irritability, anger outbursts, small arguments. What start off as a normal argument or normal conversation rather can end up in an argument in some. So when relationship is affected, irritability builds up. You're not allowed to go outside, you're not allowed to do your things. So if it's more of an individual that you are and you respect that space, so for them the familiarity breeds contempt holds true. And it has wrecked, I wouldn't say wrecked, but of course brought in some differences of opinion, and then their sexual intimacy is closely associated, as you know, with relationship. The better the relationship, the better the sexual intimacy is. So when you are not interested, or when you don't have an emotionally good relationship going on, obviously you're not interested to be touched or to touch that person. So you obviously
you see too much of that person. And
that is also true in a fair amount of people. So it is both ways. So that's how I see the situation amongst the couples.
Okay, what about people who are in a relationship but currently isolated?
Yeah.
People who are single. How has COVID changed their life, and how has it impacted them?
True. So far we were talking about couples who are staying together. So there is also a large chunk of people who are in relationships, or who used to be in live-in relationships, or just relationships. And then this distancing that we are supposed to maintain, and the quarantining thing, and the isolation that we're supposed to maintain, and lack of movement, The things which are usually associated and which we are so familiar with now already in the past few weeks and months that we are following it naturally, has brought in a dynamic shift in the way that they were functioning. In the sense that earlier you would be able to meet your partners whenever you wanted, however you wanted. You would go out, spend time together, maybe go out for a dinner or a lunch, or go to do some activities. All that is curbed. The problem that I am seeing right now is that because of these distancing and isolation that is there, so you're not able to meet each other, right? So obviously there could be a lot of problems in some people who are susceptible. Suppose if you are having trust issues, I've seen this as worsened. Because now the only modes of communication that you're having is over the phone call, over a video chat, or over technology that we can use today to sort of connect with each other. And the timings can be an issue, time zones can be an issue. If at all you and your partner are in different geographical time zones, for example, this is becoming a problem. Or even if you are not able to be available on call for a certain reason, that probably you're busy or you're working, that can be sort of misinterpreted. So trust is becoming an issue in some people. And I also see that people have not, some of them have very well adapted. Some of them have not adapted to this current situation. So they are not using technologies. So if at all, you're not using the technology, you're not keeping the communication open, or you think that there's nothing much to do, I can't go out, so there's no need for me to connect with you at that level, or there's no common interest. Earlier they would probably share a cup of tea together or go out for lunch together. But currently all those things are excluded. So it strips you down to the core you. So are you still able to maintain your relationships because of who you are? Do you have it in you to sort of maintain that relationship with each other? So hence communication, you have to use these things. You have to use video chats, you have to use certain things. Some of them have been using it and getting better, but there's a lot of other people who have got into relationships problems because they're not able to meet their partners. So both the scenarios is commonly seen, and it really depends on the kind of a personality that you have, perhaps.
We all know that it spreads through touch, contact, and do you still have people asking you whether it spreads through sexual contact? Because people still have apprehensions and they're unsure about a lot of things.
Yes. In fact, this is one of the most common questions I started, encountering when I was discussing with patients. They're really scared. So obviously, the general rules of COVID obviously is, something that we have to follow, right? So we know now that it spreads through the droplets, so closeness, etc. So obviously, sexual intimacy is all about that. So I would recommend that if at all you don't know a certain partner, if it's somebody who's not within your close circle or a trusted partner, so you don't know the status of what's actually happening. So I would advise refrain from such sexual contacts because you have no idea, because even kissing can spread. So the anal sex, like something called as rimming, where a mouth to anal sex is considered, so that can really spread also. So these are some of feces, it can spread through feces, etc. So some of these close contacts can sort of spread COVID situations, and the virus can spread through these things. So it's important to take precautions. So if it's within a closed unit, closed circle, if you still want to have sexual intimacy, there's nothing stopping you from it, and we would recommend that you use the time that is there and to improvise your sexual well-being. And also I've seen a lot of people where single men, so we earlier spoke about couples, we spoke about people in distance relationships or long distance relationships. So I just want to add a couple of bits on the single men, because I started seeing a lot of patients. So when I started getting a lot of requests for consultations, it so became that in single men there was a lot of increase in masturbatory practices. The reason could be because not being able to go out to meet the partners, number one, and the other thing is because they have a lot of time. They hold up inside the house. They're not probably managing the time so well, and access to content such as pornography and erotica is immense. So this was one of the reasons they started probably using a lot of material, and some of them also use it for tension release. They're getting stressed out at work. So I've also seen this. These days I've had a lot of patients complaining and clients complaining that the work has increased. So the time has been given, the travel time is cut off. But then the companies and the jobs are having a requirement that since you don't have these things, they're also counting those hours for the productivity time.
So the lines are blurred. So people are not really following a certain schedule, so they're working all the time. The earlier work-life balance which they used to have, because they would be required to go in an office and come back. So when they come back home, they're at home. But now that is blurred. So single men are finding it difficult to have these things, and excessive masturbation is seen. And there's a lot of problems that I see post this. So once they start masturbating excessively, what happens is their expectation is that the body should respond as it is. So even if they're masturbating twice or thrice or 4 times, they still expect the erections to happen when they want to. But unfortunately, not a lot of people know, a lot of people don't know that refractory time is something which is important. So the body may not respond. So they get into sexual anxiety. So masturbatory practices excessively so, leading to anxiousness, leading to body responses being diminished. Right? Then the fear and anxiety that something's wrong with my body and my erections are not coming through, or
so you see a lot of self-analysis. And
yes,
a lot of people doing
all the time. People have access to information today, especially anything and everything is available right now. So a lot of them get into these medical sites or regular blogs or anything that they come up with the search engines, right? So whatever the first few things that they see, they start relating themselves because they already have a mindset that I may be having this, or they start focusing excessively on themselves and focusing excessively on the problems that they're having, and they just want some information to connect. So they don't understand that the information that they may be seeing is a holistic approach. So they may just selectively pick and choose something and diagnose themselves as having some problems.
So they might be doing a wrong diagnosis of themselves or just overreacting to certain things.
Yes. Wrong diagnosis is the most important thing, because even when they come to us, we undergo through a lot of questioning and history taking and evaluation, assessment. So obviously reading up something on the internet cannot be substitute for a doctor's visit and the knowledge that you can gain by discussing with a specialist. So that's actually a problem that we are seeing these days as well.
So how is Passion Fruit as a wellness center helping people like this in a current scenario? How are you approaching your patients since they can't come over?
True.
What are you doing now? Are you allowing people to come over? What is happening?
Yes, we have taken a lot of measures. That's a very good question, because yes, times have changed. So we were one of the first guys to accept that, because we started working with it. We started giving priority to sexual wellness. Of course, the entire focus was on the virus. Entire thing was on the infection. So people stopped doing what they were doing and shifted completely to the virus. They started tracking how many deaths happened, how many counts, etc. So people started looking at it in a very different way. What we wanted to make sure that this is going to learn, this is going to continue. We need to know how to learn to live with it. That's the first thing. So we want to encourage people to understand, accept it, and learn to do with it. See, what are the things that we're going to do? We have to take precautions. We have to maintain social distancing. We have to use sanitization and other methods, so that sanitizers and stuff like that, to keep ourselves away from these things and not venture out into areas. So apart from all these things, what Passion Fruit has done is adapt early. So we started understanding that there's a need for people to recognize this, because it would be a long-term consequences if we don't do this earlier. So we started sending out emailers to our patients. We started educating people who were within our circle already, encouraging them to sort of understand these things. And of course, initial few days, as per the government regulation, we were very, we sort of closed it because we had to follow the government regulations anyway. So we didn't open the clinics initially, but post that, we have made it very easy for clients and patients to reach out to us. So though online was not the thing earlier, we adapted. We started giving out online consultations. It was easy, like how we are having a discussion now. It's as easy as for someone to be sitting from the comforts of their home to directly connect over with me through a video chat or a call and start discussing about their problems, get their queries done. But it doesn't stop there. So what we do is, that was just the initial part. So we take an history to understand the problem, but after that, a lot of patients started asking, okay, doctor, we understand that you are offering video chats. So what after that? So you understood my problem. What do I do about it? So that's an interesting, perspective.
So what happens after that? Like somebody is diagnosed or not diagnosed, testing. So now, how do you handle?
Yes. So that's the point. So we just don't want to make you understand or understand your problems. We want to treat it. So that's what we started telling people. Hey, you know what? I know that you're having a problem coming out to meet us because of the restrictions, number one. or because there is other logistic issues from the area that you're staying. So once we finish the video chat or once we finish an audio consultation, what we do is my secretary will reach out to them. So we have tie-ups with our laboratory people who can go to their home, collect the sample under complete aseptic precautions. So we are very, very careful about what we're doing because we need to know that this is the need of the hour. So we need to be sure about it. We need to ensure safety for our patients and for the personnel who are visiting. So we ensure that we give it a briefing to the patients who see us or clients who are seeing us to tell them and educate them what time they're coming, what precautions they need to take. And our guys who are going for the collection of the blood sample, so we ensure that they're taking complete precautions. We collect the sample, get it back to the lab, test it the same day, and send out the reports almost immediately. So there is no problem at all. It's as if you're doing the same thing, but it's just that sitting at the comfort of your home. So this has been appreciated a lot by my patients because so they understand that this is not going to stop them from seeking out and getting better.
True. So probably the next question that I would want to know is, so as we see the cases seem to be increasing and the solution not yet in sight. So what tips or suggestions do you have for people in relationships or people who are single going forward? What do you suggest?
Yes.
What do you?
So now I think slowly, like you rightly asked me, I think slowly the realization is coming through. So if you go back in time, when the announcements were made by the government, people thought these 2 weeks, then it'll all go away. These 2 weeks, then it'll all go away. So we need to understand that the restrictions and the lockdown and all these scenarios was just to prevent the burden on the healthcare, to minimize the impact, to minimize the severity of the problems only. But the virus is not going to go away immediately. But that doesn't mean it's going to be causing a huge cause for concern. No. We need to understand what are we going to do with it. So first is we don't have to react to any piece of information coming around this because we can be overthinking. We may be catastrophizing it. We may be reading too much, not just between the lines, but beyond the lines. We may be reading too much into this data and then, personalizing everything. That's the sort of overthinking I see. So I would request firstly people to accept the current situation that we are in and not to really overthink on these lines and to learn to adapt to this lifestyle. Accepting, living through it is important. The second thing is please prioritize yourselves. Please prioritize your health. Please prioritize your own self and relationships also because that becomes essential component. Because of something which came and hit us, we don't want to let go of everything that we have. We have built these things over a period of time. So relationships are important. Bonding with friends is important, but with precautions. So you could probably use technology to do that. And I'm sure that, we're seeing a lot of people doing that, connecting over calls, connecting over video chat. So people have been doing it. So there are examples right in front of us. So we should start doing these things as much as possible because after all, humans are social animals. So we need people. We need that validation. We need things to sort of feel, with our fellow human beings so that we can connect with each other and be there. That is true for even couples as well. So I would say couples need to prioritize themselves and their relationships. So it's one of the best opportunities for them to sort of work on. If at all they had some relationship issue, now's the best time. So I say this to a lot of my clients as well that, look, if you have not been able to use lockdown to really improve your relationship, so whatever that you were complaining of, that your commute time was too much and I was too busy at work, doesn't hold true because it's not about time, it's about motivation. So you need to have that motivation. So how do we do this is a question that I commonly get it. So what do I do as a couple? What do I do right now? So please follow a certain schedule. I'll tell you why. Because the work-life balance is taken off. So now you can work whenever you want, however you want. But that is actually having a flip side because your brain's programming is changing. Please realize this, that the brain program is changing. The brain doesn't know when, what, how, if you don't let it know. So if someone who's not following a certain schedule, the lines get blurred. Suppose you're sitting on your bed and working all day long, and suddenly in the evening you just want to close the laptop and get intimate with your partner. The brain's not shifted so suddenly. Your conscious may have shifted, but your internal systems, which has been driving the work, doesn't shift so easily. So people have come to me that, I'm not able to get the sleep, I'm not able to get sexual arousal, etc. And then the simplest of the solutions was this. When I dug up, when I dig up deep into the history, then, I found out that these were relationship issues were primarily because of they were not following a certain regimen or, a certain habit which they were used to earlier. So scheduling of activities is one important thing. Workouts are important. So what if you can't go out? Work out at home. Follow some mindfulness techniques. It's important to reconnect with ourselves. It's important to feel peaceful from within. So breathing techniques are important because breathing is the remote control to the brain. So you can control your brain, you can control your thoughts, you can control your anxiety and overthink by following certain deep breathing techniques. Pranayama has been established to really help people. Mindfulness or awareness is really established to help people. So I would say work out, exercise, spend quality time, find out some fun things to do. Shut off your laptop for a while. Go no device hours. That's what I recommend for a lot of people. I'd say cut off from 6 to 8, no devices, absolutely. Cut off your phones, cut off your laptops, TVs, etc. Go back in time, sit across, sit and discuss, with your partner. So find some interesting hobbies to do. So these are some things which I can recommend as a normal thing, and obviously following a diet is important. So don't keep junking on things because it's easy, right? When you're sitting somewhere, you're junking on something. You're watching a lot of Netflix or binging on series. You're junking something. So please give up this unhealthy lifestyle. Having a sense of awareness, realization as to what are we doing right now. Is this really good for me in the long run? So that's important to take. So that's how the couples can improve. The people in relationships, long distances, like I already mentioned, use technology, connect mutually with each other, ensure that there's a mutual respect, mutual trust, sense of warmth, and communicate clearly. When you're long distance, communications work really, really well. If you are able to communicate your feelings to the partner and vice versa, if you give some heed to what the partner is saying, if you really understand and empathize with each other, I'm sure even long distance relationships can work a lot. So these are some of the qualities which will help you to maintain long distances. So being stable, emotionally stable is really, really important. So that's something for single men as well. You can pick up a lot of hobbies. You always have the time. You always wanted to do a lot of things. Now's the time to pick up. If you wanted to learn a language, do it now. If you wanted to improvise on your certification skills, use it now. So many things that we have left unorganized because of the lack of time, which we thought was like, small things, maybe financial things, maybe bank records, maybe documents, maybe something else concerning work or other things. So now's the time to really use that. So, and get better. The idea is that lifestyle should not change. Diet should be healthy. You should be able to pick up something which interests you, because every day, at least an hour, if you give something to your brain that you really enjoy, the brain's going to be much more better. So do not lose sleep. So please, this is something very important. We need to understand we can't lose sleep, because sleep problems eventually lead to overthinking, anxiety, irritability, mood disturbances. It's all as you're realizing what I'm telling you, right? It's all connected to each other. It's about who we are, our personality, what we think, our understanding, relationship, our skill set, coping up mechanisms. So these are certain things that we need to integrate and put together.
Same thing applies to single women?
Yes, of course. Same thing applies to single women too. So they're no different. But of course, a woman's sexual health perspective also depends on the cycles. So if at all your menstrual cycle irregularities are there, or the hormonal disturbances are there, lifestyle has helped a lot of women, especially ones with polycystic ovaries. I commonly see is commonly associated with sexual drive issues and things like that. It may be surprising, but a lot of people don't know this, but oral contraceptive pills that they may be on changes their partner's perception, changes their sexual desire and things like that. So from a woman health perspective, we want to educate women to understand the implications of these things and how important it is to actually have a good lifestyle as well and good diet. That's a common thing which we all have to follow, except the hormonal balances and things which needs to be maintained is a certain additional thing. So most importantly, I forgot to mention this, but it's really important that during this time, the hygiene aspects. So that is something which is true for all of us. So, we need to maintain the specific hygiene, basic hygiene, and, concerning our grooming, which is really important bit to how we feel when you're trying to be intimate. So
what exactly do you mean when you say hygiene, sexual hygiene?
Sexual hygiene is something that, you need to be groomed up. So I refer to this as manscaping. Okay. So for a man, they feel that it's not really important to be groomed enough because it's okay to feel sexually attracted or attractive. But that's the truth, because see, sex is a sensual experience, isn't it? You use all your senses. Sense of smell is one of them. So obviously, that's why the perfume industry is booming so much. So if at all you don't smell well, so the chances of the partner getting aroused may not be there. So if at all you're not groomed up well, the way the partner perceives you and the way you perceive your partner is different. I'm not trying to highlight this too much. I'm not saying jazz it up too much. All I'm saying is basic hygiene needs to be maintained. Because again, I told you, when you don't have a schedule, you're probably not taking a shower at the right time. Just going back to basics like that. So this is something sometimes which is neglected, but a very important bit. So there have been times in a couple of my patients I've seen when bad breath has been one of the reasons why they have not been intimate. Somebody doesn't want to go down on somebody because of certain aspects such as concerning hygiene, and they were too hesitant. So hence communication, as I mentioned earlier, is really one of the important things that you can sort of build between each other to improvise a lot of things.
So what you were talking about, these senses, what are the other senses that?
Yeah, sense of smell, sense of touch, sense of taste and hearing and seeing. The 5 senses that we use. So sex is not really only about the genitals as a lot of people think. Sex is also sensual. So the more sensual experiences you have in sex, the better it gets to arouse your systems, which will give out a better responses to your body. So sex has to be understood from a sensual perspective for people to enjoy that, not as a goal-directed activity or a task or an exam where a sense of fear is like inculcated because of the previous experiences that somebody may have had. So a broader aspect or a broader horizon of understanding sexuality and sensuality is what we encourage. So in a lot of my clients and patients, not a lot, almost everybody who comes in here gets a different understanding. So that's why we are so different in terms of what we are trying to educate. So in India, we don't have sex education. So a lot of us are, or a lot of people are in a place where they're hesitant to talk to someone because they don't know who to talk to, and they don't have the right information from a proper channel. So they get also deviated because of certain blogs or some things that they may have read, form their own opinions, etc. So these are all the things that actually is a problem that we are seeing. So right from that to sex education in children, sex education in adults, young teenagers, what is okay, what is not okay. So there's a lot of aspects that we're trying to cover, and basically we want people to ask us. We want people to understand what their bodies are, what it is, etc. So that they can.
You call it as passion fruit.
Exactly, you guessed it right.